Good afternoon, and welcome to the 2021 White House HBCU Conference Interactive Health Session of the United States Public Health Service Commissioned Corps. My name is Lieutenant Commander Chelsea Boston, a pharmacy officer within the United States Public Health Service Commissioned Corps and the chair of the Black Commissioned Officers Advisory Group, also known as BCOG. I will serve as your moderator for part of this session. Before we begin, I would like to share some housekeeping matters. This event is being recorded. All lines are muted. Should you have any questions, we ask that you enter all your questions in the chat box. First, a brief word about BCOG. BCOG serves as an advisory group to the Surgeon General on issues of interest and concerns of Black officers in the United States Public Health Service. We truly consider it an honor to participate in this influential conference. Today, you will hear from various BCOG officers, many of whom are HBCU graduates, on topics of interest to public health. Our agenda for today includes 3 sections. Part 1, there will be various speaker presentations. Part 2 will include our healthcare education session. And lastly, an exciting game of Jeopardy! At this time, I would like to introduce our distinguished keynote speaker, Rear Admiral Cedric Guyton. Rear Admiral Cedric Guyton is the Deputy Director for Commissioned Corps Services. As the Deputy Director of Commissioned Corps Services, Rear Admiral Guyton is responsible for providing leadership and oversight of the development and implementation of officer recruitment, readiness, and deployment, career management, including assignment, separations, and promotions, and training services necessary to successfully manage 6,000 plus active duty officers of the Commissioned Corps. He is operationally in charge of 4 senior leaders and 40 plus officer and civilian employees. In support of the USPHS, Rear Admiral Guyton has served in multiple leadership roles, such as first Black Commissioned Officers Advisory Group Senior Advisor and Deputy Team Commander for Service Access Team 4. Throughout his 17-year Commissioned Corps career, across 5 agencies and 4 duty stations, Rear Admiral Guyton has vehemently promoted the Commissioned Corps' mission to promote, to protect, promote, and advance the health and safety of the nation. He is committed to strengthening the Corps as a national and global resource. At this time, Rear Admiral Guyton, you do have the floor, sir.
Thank you, Lieutenant Commander. It is a great day to be here, and I want to thank the 2021 National White House Historically Black College and University Conference team for inviting the USPHS Black Commissioned Corps Advisory Group. This is a momentous occasion for us, and as COVID has impacted every aspect of our lives, it definitely has not impacted the enthusiasm of our BCOG officers to be here to present to you today. Again, my name is Rear Admiral Cedric Guyton. I serve as the Deputy Director within the Commissioned Corps headquarters and as one of 26 Assistant Surgeon Generals within the Office of the Surgeon General. My main duty station is at the Commissioned Corps headquarters. I've had the honor as the Deputy Director to manage the training, development, officer promotions, and also for the last 20 months, I've helped and managed the daily deployment of the over 3,000 of our 6,000 officers to support our COVID-19 missions within the communities in the U.S. and abroad. The great honor of being here because the Commissioned Corps of the United States Public Health Service, which is one of the 8 uniformed services, works on the front lines of public health every day. Our medical, health, engineering professionals fight disease, conduct research, and care for patients in underserved communities across the nation and throughout the world. Our officers work tirelessly to protect, promote, and advance the health of this great nation. For the last 2 years, I've had the great honor of serving as the first Black Commissioned Corps Officers Advisory Group Senior Advisor. The BCOG, that we call it BCOG, was chartered in February 7th of 1990. Originally, BCOG was called the Black Commissioned Officer Steering Committee. This group was formed out of a delegation of officers who attended a 1987 meeting with the Congressional Black Caucus Health Brain Trust. Under the leadership of Rear Admiral Aubrey Manley, the group was formally organized and developed a report of recommendations and initiatives for consideration by our then Surgeon General, C. Everett Koop. BCOG has continued to provide assistance and leadership and consultation to the Office of the Surgeon General on many issues related to the representation and participation of African Americans in the USPHS as officers. Many of our BCOG officers, as announced earlier, are proud HBCU graduates, so this program is really, really special to them. They work daily protecting the health of this great nation. I myself am a proud graduate of a couple of HBCUs. I graduated from the Riverside of Albany State University and from the Hills of Florida A&M University. That's right, I'm a proud graduate of 2 HBCUs. And what I've discovered being a proud graduate of HBCUs is the life lessons and skills I gained while attending that HBCU have prepared me for any career or any opportunity that you can ever dream of anywhere in the world. As a young man, coming from a small town in Georgia, my HBCU experience provided me with the ability to dream and accomplish anything. It provided me with the courage to challenge the norms, celebrate my culture, and find and blaze a path of my own. Learning about MLK, W.E.B. Du Bois, Carter G. Woolsey, Ernest Everett Just, Charles Drew, greatly influenced me to be the man, officer, and leader I am today. I can tell you I thrived largely due to the part of the inclusiveness and the nurturing learning environment found at my HBCU. The initial comfort and socially inclusive environment fully prepared me for any challenge I have faced thus far in my career and any challenge that I will face in my life. What I would like to impart is one great quote from a fraternity brother of mine, Carter G. Woolsey. The mere parting of information is not education. And I couldn't understand that for many years. And then I grew to understand that the quote means because of the entire HBCU experience, which includes, yes, the knowledge provided via a textbook, but it also includes the essential and tangible life skills. That is in totality the education that has prepared all of us HBCU grads for life. As the country continues to grow, and we realize the greatest asset of this country is diversity, HBCUs play a major role in ensuring equity and diversity and educational opportunities throughout this country. And we are happy to be here to support this great initiative and will continue to participate as much as possible and much as required from this great country. The great group of officers that you're about to hear from will now educate and inform you on a number of important health topics that impact this great nation and your health. I leave you with our motto, as we all are BCOG officers and PHS officers. We always say, in the service of health. Enjoy the conference. Have a great afternoon. Have a great day.
Thank you, Rear Admiral Guyton, for those excellent words. I would now like to introduce our next presenter, Lieutenant Commander Yvette Macklin. Lieutenant Commander Yvette Macklin is a nursing informatics specialist and currently serves as a program manager for the Food and Drug Administration, Office of Compliance and Enforcement within the Center of Tobacco Products. She is a dedicated leader within the BCOG Recruitment, Retention, and Readiness Committee. Lieutenant Commander Macklin, you do have the floor, ma'am.
Thank you, ma'am. Good afternoon, everyone. I'm Lieutenant Commander Yvette Macklin, and today I will be talking to you about the United States Public Health Service Commissioned Corps. Lieutenant Commander Nuri Tawal will be assisting with Q&A if time allows after the presentation. If you have any questions, please put them in the chat to expedite the process. I will be discussing who we are as a Commissioned Corps, our mission and values, what we do, our benefits, what agencies we work within, the professional categories that we serve in the Corps, readiness and deployment, a little bit about the Ready Reserve Corps, and the steps you can take to become a United States Public Health Service Commissioned Corps. Next slide, please. Our motto, Officio Salutis, meaning in the service of health. The Commissioned Corps was established in 1889 and solely committed to protecting the public's health. We are housed under the United States Department of Health and Human Services and led by the Assistant Secretary for Health and the United States Surgeon General. Next slide, please. Who we are. The United States Public Health Service Commissioned Corps is one of 8 uniformed services, and we are the only service dedicated solely to protecting, promoting, and advancing Americans' public health. We are 6,000 plus healthcare professionals that are inspired by the call to serve vulnerable and underserved communities through addressing public health issues. We are led by the Assistant Secretary for Health and operations and activities overseen by United States Surgeon General. Next slide, please. Our mission and values. Our mission is to protect, promote, and advance the health and safety of the nation. Our values. Leadership. We provide vision and purpose in public health through inspiration, dedication, and loyalty. Service. We are committed to the public health through compassionate actions and stewardship of time, resources, and talents. Integrity. We exemplify uncompromising ethical conduct and maintaining the highest standard and responsibility and accountability. Excellence. We exhibit superior performance and continuous improvement in knowledge and expertise. Next slide, please. What we do. The Commissioned Corps Public Health Service officers serve throughout the federal government to provide essential health care services to underserved and vulnerable populations, respond to public health and or global emergencies, lead public health programs and policy developments, and we work on the forefront to advance innovation in science. Next slide, please. Some benefits of a career with the United States Public Health Service Commissioned Corps. Career diversity, the ability to create your own career path, focus on health service practices, policies, and programs while working across the United States Department of Health and Human Services and with other federal agencies. Professional development. There are opportunities for training and education to advance your career to serve in leadership positions. Work-life balance. You will receive 30-day paid leave per year that begins to accumulate on the first month of active duty. Financial advantages. Non-taxable housing and substance allowance with the possibility of specialty pay. Economical health benefits for public health service officers and their families, and a 401 style retirement plan. Life insurance and survivors benefits. Next slide, please. Where we work. The Commissioned Corps currently has a presence in more than 800 locations, including all 50 states and numerous foreign assignments, such as the World Health Organization and World Bank. To name a few of the top agencies, we have CDC, CMS, FDA, Health Resources and Service Administration, HRSA, Indian Health Service, the National Institutes of Health, Substance Abuse and Mental Health Service Administration. Some other agencies include, but not limited to, Administration for Children and Family, Agencies for Healthcare Research and Quality, USDA, EPA, and the Veterans Affairs, to name a few. Please note there are contingencies associated with assignments at the state and local agency. Next slide, please. Professional categories. The Commissioned Corps is an elite uniformed service with over 6,000 full-time, highly qualified public health professionals, serving in the most underserved and vulnerable population, domestically and abroad. The categories include physicians, dentists, veterinarians, dietitians, scientists, nurses, engineers, health services, environmental health specialists, therapists, and pharmacists. Next slide, please. Serve as a nurse practitioner. Nurse practitioners in the United States Commissioned Corps address critical public health needs and provide care for the nation's most vulnerable populations. They work in diverse roles across the federal government to provide clinical care, develop health policies, perform research, and lead public health programs. With the United States Public Health Service Commissioned Corps, you can do what you do best, help those in need. Next slide, please. serve as a dentist. Dentists in the United States Public Health Service Commissioned Corps are on a mission for better oral health in a healthier nation by providing care to the most vulnerable and underserved populations in America. Dental officers work with specialty populations, contribute to public policies, and respond to national emergencies. They may also serve in non-clinical roles in program management, research, surveillance, and education across a diverse and array of agencies. Join us in working with federal partners, organized dentistry, and within your own agency to help promote oral health. Next slide, please. Serve as a physician. Physicians in the United States Public Health Service Commissioned Corps serve in a wide variety of clinical and geographical settings. Public health service physicians work in rural areas to promote the health and underserved communities, work in the development of national health policies, and participate in agency work that brings new therapies, diagnostic tests, and next generation innovation to patient care. Join us to immerse yourself in clinical care, public health, and collaborate with the physicians across the uniformed service to make a real difference. Next slide, please. Serve as a veterinarian. Veterinarians in the United States Public Health Service Commissioned Corps go beyond the routine animal care. They lead prevention programs, responding to outbreaks, and enforcing humane treatment policies. Veterinarians conduct critical work in responding to animal and human disease outbreaks, manage disease prevention and control programs, and ensure public safety as a public health compliance and quarantine officers. They conduct medical and biological research, regulate drugs, and monitor vaccine development. Come join us to pursue a career path unlike any other veterinary practice. Next slide, please. Readiness and deployment. As Americans' health responders, public health service officers are the first in line to defend our nation's public health against threats large and small. When disaster strikes and when new health threats demand rapid and precise answers, the United States Public Health Service Commissioned Corps officers are there. The Office of Surgeon General, through Commissioned Corps headquarters, is responsible for the coordination and readiness and deployments for domestic and international operations, team and individual deployments, humanitarian assistance, disaster relief, emergency response, and global training. Next slide, please. Join our noble efforts. Join a dedicated team of public health service professionals of service and receive opportunities for excellent career growth and increased professional development while qualifying for a variety of financial benefits like non-taxable housing and subsistence allowances, comprehensive health benefits at no cost, and a 401-style retirement plan. Next slide, please. What we offer. The United States Commissioned Corps offers competitive salaries starting that increases with promotions every year of service, 30 days of paid vacation year beginning the first year, healthcare and dental costs at no cost, tax-free housing and meal allowance, and much, much more. Next slide, please. The Ready Reserve Corps. The Coronavirus Aid, Relief, and Economic Security CARES Act, signed into law on March 27 of 2020, provides both the authority and funding for the establishment of the Ready Reserve Corps as a reserve component of the United States Public Health Service Commissioned Corps. The Ready Reserve Corps will provide training and ready personnel to fill critical public health needs and will support the United States Public Health Service Commissioned Corps capacity to respond to regional, national, and global health emergencies and improve access to health services. The Ready Reserve Corps will also provide opportunity for public health professionals who can commit to a part-time active duty positions to serve their country. The CARES Act gave the United States Department of Health and Human Services statutory authority to reestablish the reserve component and provide compensation and benefit. The United States Public Health Service Commissioned Corps started accepting Ready Reserve Corps applications online beginning in the fall of 2020. The USPHS Corps is looking for service-driven individuals who desire to work in public health programs and clinical settings. For more information, please visit www.uspphs.gov. Next slide, please. To become a United States Public Health Service Commissioned Corps officer, you only have 8 steps to follow. Step 1, visit the website, USPHS.gov, select Ready to Apply to register as a new user for the Application Enrollment System, AES. Step 2, create and activate your account by selecting Start Application. Step 3, start your pre-screen. Step 4, submit required materials. Step 5, stand ready to interview with the Professional Category Board. Step 6, complete remaining 3 commissioning requirements. Step 7, seek employment opportunities with federal agencies. And Step 8, call to active duty. If you have any questions or need further assistance, please contact the call center at 888-225-3302 or direct your questions to cchelpdesk@hhs.gov. Next slide, please. The Black Commissioned Corps Officer Advisory Group, BCOG. Next slide, please. The mission of BCOG is to provide consultation and advice to the Surgeon General on issues of interest and concern of Black officers, civil servant activities, and other Commissioned Corps personnel, to support the career advancement and professional development of Black officers, to support the Office of Surgeon General initiatives, to serve minority and local communities in reducing health disparities. BCOG is one of 4 minority advisory groups within the United States Public Health Service. Next slide, please. BCOG has approximately 8 committees that provide service to our officers and communities. We provide mentoring. We review PHS awards and promotion documents. We have a career development and leadership training. We provide networking opportunities, something that is very valuable to PHS officers. We have community outreach missions like Post-Katrina in New Orleans and hometown missions. We support STEM programs, K through 12, and also science fairs. As I stated in the previous slide, we support the Surgeon General's initiative. Next slide, please. So that concludes my presentation. I hope that you all received some great information that provides you with options that will assist you in making some decisions for your career path. Now, if time allows, we could answer 1 or 2 questions with the assistance of Lieutenant Commander Nuri Tawab. Ma'am, I yield the floor to you if there's any questions in the chat.
Thank you, ma'am, for your very informative presentation. If there are any questions at this time, you may enter them into the chat box. We do have time for 1 to 2 questions. We have 1 question that was entered into the chat box. Are there any age restrictions or disabilities?
Lieutenant Commander Nuri Tawab, do you know the answer to that question?
Yes, currently there's an age restriction. There's also an age of 44. There is possibilities due to the need of the Corps and your expertise that can be looked at further during your evaluation process. Usually in the phase 1 process, they go through the application and look at the medical review and the board review. And they will, based off your information you submit, honest information you submit, they will go through and determine if you qualify based off any medical conditions that you have. And usually, if you make it through that phase 1 process, as far as medical review, you should be fine. Thank you.
Thank you, sir, for your feedback and answering that question. As there are no further questions, we will now move on to our next presenters. Next slide, please. I would like to introduce our next presenters, starting with Commander Valerie Marshall. Commander Valerie Marshall is a Senior Public Health Advisor at the Food and Drug Administration's Office of Vaccines and lead of the BCOG Vaccine Hesitancy Task Force. She represents the FDA as an ex officio member of the National Vaccine Advisory Committee and the Advisory Commission on Childhood Vaccines. Next, I would like to introduce Lieutenant Commander Kotalichi Achozo. Lieutenant Commander Achozo is a dual board-certified pharmacotherapy specialist and ambulatory care pharmacist who serves as a labeling reviewer with the Food and Drug Administration. She has planned and given several COVID-19 presentations as the internal outreach lead for the VCOG Vaccine Hesitancy Task Force. At this time, Commander Marshall and Lieutenant Commander Achozo, the floor is yours.
Good afternoon. It is our honor to speak to you today on empowering conversations to address COVID-19 misinformation. We've all heard myths and misinformation on COVID-19 vaccines, but today we will discuss how we can best engage our communities while providing accurate information. Next slide, please. We will start out with this important disclaimer. The views and opinions presented are those of the speakers and do not necessarily represent the views of the Department of Health and Human Services or its components. Next slide, please. Today's presentation will focus on equipping you with the facts about COVID-19 vaccines and provide you with effective communication strategies on engaging friends, family, and your community in empowering conversations. Lastly, we'll end with a call to action. We can each make positive and proactive contributions to end the pandemic. Next slide, please. We've been battling the COVID-19 pandemic for quite some time. While headway has been made towards a return to normalcy, the Delta variant is a true game changer. It is disrupting the progress that we've seen as more and more cases of COVID-19 spread through communities. The Delta variant is highly contagious, more than 2 times as contagious as previous variants. Data suggests the Delta variant might cause more severe illness than previous strains in unvaccinated persons. It is not yet clear whether the Delta variant causes more severe disease in children, but its high level of infectiousness is causing a surge of COVID-19 cases in younger children that we did not see with the first wave. Unvaccinated people remain the greatest public health concern due to the Delta variant's high rate of transmissibility and potential to cause severe disease. Next slide, please. So just how contagious is the Delta variant? This snapshot shows how quickly the nation progressed from low to moderate transmission in July to high transmission in August. The map flipped from tan blue with specks of red to nearly all red in 1 month. More than 98% of US citizens or residents now live in an area where there is a high or substantial risk of COVID-19 community transmission, compared to in July, when only 19% of residents lived in high-risk areas. Low vaccination coverage in many communities is driving the rapid surge of cases associated with the Delta variant, which also increases the chances that even more concerning variants could emerge. Next slide, please. So, what can we do? COVID-19 vaccination is a critical prevention measure to help end the COVID-19 pandemic. All 3 COVID-19 vaccines, the Pfizer vaccine is licensed, Moderna and Janssen are authorized. All 3 vaccines are effective against COVID-19, including the serious outcomes of severe disease, hospitalization, and death. COVID-19 vaccines, like all vaccines, are not 100% effective at preventing infection. Some people who are fully vaccinated will still get COVID-19, and this is called a breakthrough infection. However, fully vaccinated people with a breakthrough infection are less likely to develop serious illness than those who are unvaccinated. Even when fully vaccinated people develop symptoms, they tend to be less severe than in unvaccinated people. The bottom line is that COVID-19 vaccines protect against severe illness, including disease caused by the Delta variant and other variants circulating in the United States. COVID-19 vaccines are now widely available in the United States, and CDC recommends vaccination for everyone 12 years of age and older. Next slide, please. Current data suggests that uptake of COVID-19 vaccines are below expected levels. Next slide, please. With so many rumors circulating, let's briefly address 5 important facts about COVID-19 vaccines. Next slide, please. The vaccine causes COVID-19. Next slide, please. That is fiction. Next slide, please. None of the COVID-19 vaccines authorized or licensed in the United States contain the live virus that causes COVID-19. This means that a COVID-19 vaccine cannot make you sick with COVID-19. Next slide, please. COVID-19 vaccines were rushed. Next slide, please. That's fiction. Next slide, please. The circumstances of the pandemic necessitated a quicker than usual development process, which fostered misperceptions that corners were cut. COVID-19 vaccines were developed based on years of previous research on related viruses, vaccine technology, and faster ways to manufacture vaccines, as well as funding that allowed multiple clinical trials to run in parallel. Next slide, please. There is a tracking microchip in the COVID-19 vaccine. That is fiction. Next, please. COVID-19 vaccines do not contain microchips. Vaccines are developed to fight against disease and are not administered to track your movement. The CDC website, a source of accurate information, contains all the ingredients contained in each vaccine. Next slide, please. COVID-19 vaccines will alter my DNA. That's fiction. COVID-19 vaccines do not change or interact with your DNA. Both mRNA and viral vector COVID-19 vaccines deliver instructions to our cells to start building protection against the virus that causes COVID-19. However, the material never enters the nucleus of the cell, which is where our DNA is kept. Next slide, please. I don't need the vaccine because I've already had COVID. That's fiction. Next, please. You should get vaccinated regardless of whether you already had COVID-19. Studies have shown that vaccination provides a strong boost of protection in people who have recovered from COVID-19. Next slide, please. In summary, COVID-19 vaccination is an important tool to help stop the pandemic. Vaccines have been demonstrated to be safe and effective. Misinformation does contribute to fear and reluctance. I will now turn the remainder of the presentation over to Lieutenant Commander Chozo. Ma'am, you have the floor.
Thank you, Commander Marshall. Next slide, please. You have all just received important information regarding COVID-19 vaccines and may be wondering, so what's next? Where do I go from here? And how can I make a difference from where I am? The objective for this second part of the presentation is to empower you with tools to have an impactful conversation with your loved ones, families, and friends. Next slide, please. During the COVID-19 pandemic, people have been exposed to a great deal of information from various sources, such as the news, public health guidance, fact sheets, opinions, rumors, myths, and much, much more. Amid all this information, many people have also been exposed to health misinformation, meaning information that is false, inaccurate, or misleading. Misinformation has caused confusion and led people to decline COVID-19 vaccines, reject public health measures such as masking and physical distancing, and use unproven treatments. For example, a recent study showed that even brief exposure to COVID-19 vaccine misinformation made people less likely to want a COVID-19 vaccine. Our Surgeon General has given us our first tool, which is an advisory on confronting health misinformation. He stated, "I am urging all Americans to help slow the spread of health misinformation during the COVID-19 pandemic and beyond. Health misinformation is a serious threat to public health. It can cause confusion, sow mistrust, harm people's health, and undermine public health efforts. Limiting the spread of health misinformation is a moral and civic imperative that will require a whole of society effort." So how can we do this? Next slide, please. First, you should recognize that when many of us share misinformation, we don't do it intentionally. We are trying to inform others and don't realize that the information is false. Examples of how to spot misinformation tactics include when people present unqualified people as experts, misleading consumers with logical fallacies, setting impossible expectations for scientific research, cherry-picking data or anecdotes, and introducing conspiracy theories. What action can you take? Before posting or sharing an item on social media or any platform, for example, we can take a moment to verify whether the information is accurate and whether the original source is trustworthy. If we're not sure, we can choose not to share. Next slide, please. Thank you all for doing your part to protect yourself and those around you by getting vaccinated. The decision to take a COVID-19 vaccine is not by coercion, but by personal empowerment. Trying to persuade people by pressuring them to make the decision we want to make is rarely effective and may create resistance. The next tool I would like to share with you is motivational interviewing. It is a respectful and guiding style of communication that is designed to empower people to change by drawing out their own meaning, importance, and capacity for change. It also facilitates the natural process of change while honoring autonomy. In these conversations, please engage with the other individual as an equal partner and refrain from giving unsolicited advice, confronting, instructing, directing, or even warning them. Next slide, please. The OARS Plus model is utilized in motivational interviewing. It is an acronym that stands for open-ended questions, affirmative statements, reflections, summary statements, and offering information with permission. When discussing COVID-19 vaccines, ask open-ended questions that can't be answered with a yes or no to engage the person in a two-way dialogue with a goal of trying to understand their barriers, concerns, and/or expectations. Recognize and affirm their values, perspectives, strengths, and efforts with a goal to promote a collaborative relationship. Use reflective listening to respond thoughtfully by paraphrasing their points of view and allowing the person to hear their own words, thoughts, or feelings reflected to them with a goal to confirm that they've been heard and acknowledged. Use statements that recount and clarify what the person has said and identify specific areas that they can act on with a goal to clearly and respectfully conclude the conversation. Lastly, always ask for permission to offer your own experience and/or information with a goal to foster openness and connect based on respect and not to persuade or convince. Remember, coming in with unsolicited advice can immediately create resistance. Now let's take a look at what this looks like in practice. Next slide, please. So how can the OARS model be used in COVID-19 vaccine conversation? This slide has examples of how this model can be implemented. When broaching the topic of COVID-19 vaccines, you can begin with an open-ended question like, how are you feeling about the vaccine? Then follow up with, what concerns do you have? What reasons do you see to get the vaccine? After hearing their response, you can affirm their perspective by saying something like, I can see that you really care about this. I can see you've done a lot of research. And then thank them for being open, honest, and transparent with you. For example, thank you for being honest with me. I hear that you've been really weighing this out carefully. It is important to then reflect on what you heard them say. For example, what I hear you saying is that correct? Or it sounds like you're feeling worried about. Using a summary statement, you could propel them to take an action. So you mentioned several things that you could do to find out more. You also said that you will talk to your friends, family, or doctor. Or you said you would like help with. Have I missed anything? Lastly, you can conclude with asking to provide your personal insight or information. For example, may I share my own experience? Or I was really afraid, but ultimately decided to get the vaccine because. Would it help if I shared my reasoning or what helped me? Now that I've shared examples of how the OARS Plus model can be implemented, let's proceed with next steps. Next slide, please. During the COVID-19 pandemic, health misinformation has sowed confusion, reduced trust in public health measures, hindered efforts to get Americans vaccinated. Misinformation hasn't just harmed our physical health. It has also divided our families, friends, and communities. We must work together to establish trust on a community level. First, seek to understand instead of passing judgment. Listen with empathy. Establish a common ground. Ask questions. Provide explanation and trustworthy sources of information. Remember to stay calm and don't expect success from just one conversation. Additionally, give context and concern to the increased risk of COVID-19 in minority communities. Next slide, please. I would like to thank you all for your undivided attention. At this time, I would like to also open the floor for questions, time permitting. Lieutenant Commander Bostic, I yield the floor back to you, ma'am.
Thank you, ma'am. And thank you both for that excellent and informative presentation. At this time, if there are any questions for our presenters, please enter them into the chat box. We do have one question that was posed earlier in your presentation that I would like to pose to our presenters. The new COVID-19 variant, Mu, what information do you have about this new variant? And will the current vaccines protect against Mu?
This is Commander Marshall. So genetic variants of SARS-CoV-2 have been emerging and circulating around the world throughout the pandemic. Viral mutations and variants are routinely monitored through sequence-based surveillance, laboratory studies, and epidemiological investigations. The Mu variant is being monitored and further study is ongoing. Thank you.
Thank you both for that excellent presentation. We have one last question before we move forward. Do you think COVID vaccines will become commonplace like the flu vaccine? Commander Marshall, would you like to tackle this question?
Sure. We certainly hope that everyone will take their COVID-19 vaccination and that rates would actually be higher. Our hope is that rates will be higher than the influenza vaccination. So yes, we do hope that it is a common and routinely recommended vaccination.
Thank you, ma'am.
Thank you.
Thank you. We have one last question. This question I will direct towards Lieutenant Commander Chozo. Are there any training materials on the OARS method?
Thank you, ma'am. And thank you to the individual who posed the question. There are several online resources for the OARS Plus model that are available. One that comes to mind is from the Agency for Healthcare Research and Quality, and that can be found just by searching for OARS model, and it will be entitled the OARS Model Essential Communication Skills. Thank you.
Thank you, ma'am. And thank you for those great questions that have been posed. Seeming that there are no further questions, I would now like to turn the session over to our next moderator, Lieutenant Adejuwan. Ma'am, the floor is now yours.
Thank you very much, Lieutenant Commander Bostic, for the introduction. Good afternoon, everyone. Once again, my name is Lieutenant Adesola Adejuwan, a pharmacist by profession, and I'm currently stationed at the Food and Drug Administration as a regulatory review officer. As we transition to part 2 of today's session, I will be moderating the healthcare education session. During this session, there will be presentations on diverse topics to include mental health, diabetes, dental health, opioid crisis, as well as fitness and nutrition. Please stay tuned as we progress through these various topics. Next slide, please. First topic will be on mental health, presented by Lieutenant Commander Jennifer Weeks. Lieutenant Commander Weeks is dually credentialed with a PhD in public health and master's in social work. She serves as a senior public health analyst at the Health Resources and Services Administration. She is a certified health education specialist and board certified licensed independent clinical social worker. Ma'am, you have the floor.
Good afternoon, everyone. Thank you, ma'am, for that introduction. Mental health is our emotional, psychological, and social well-being. Mental health affects how we think, feel, and act. It also determines how we handle stress, relate to others, and make choices. Mental health is very important at every stage of life, from childhood and adolescence through adulthood. Our mental health is just as important as our physical health. Factors that contribute to mental health problems include biological factors, which are genes and brain chemistry, life experiences related to trauma and abuse, and a family history of mental health problems. Mental health problems are common, but help is available. Individuals with mental health problems can get better, and many recover completely. When needed, seek help and support from a mental health professional. As a mental health professional myself, I acknowledge that it takes courage to ask for help. However, I encourage you to avoid suffering mental health challenges in silence. Reach out. Help is available. Positive mental health allows us to realize our full potential, cope with the stressors of life, work productively, and make meaningful contributions to our communities. Ways to maintain positive mental health include getting professional help if and when needed, connecting with others, loved ones, and friends, staying positive, being physically active, helping others, getting adequate sleep, and developing coping skills. Stress can negatively affect our mental health, causing symptoms of anxiety, restlessness, social withdrawal, lack of motivation, focus, irritability, anger, sadness, or depression. Next slide, please. Stress reduction techniques are currently projected on the screen. Please take note. The stress reduction techniques projected on the screen help us cope with stress using healthy and productive strategies, offer positive distractions, promotes mindfulness, presence, grounding, and balance, and also provides mental relief from feelings of stress and allows for problem solving. I encourage you to engage in the stress reduction techniques displayed on this slide. For example, taking a walk, deep breathing, gratitude journaling, listening to music, all are strategies and techniques that help promote positive mental health and manage stress when needed. I personally engage in stress reduction techniques listed on this slide, and they have been helpful to maintaining positive mental health and overall stress management. Thank you for your time and attention. I yield the floor back to Lieutenant Adijuwan. Thank you, ma'am.
Thank you, Lieutenant Commander Weeks, for your wonderful presentation on mental health. So the next slide, please, actually. The next topic of discussion is on diabetes, presented by Lieutenant Commander Kalisha Gentles. Lieutenant Commander Gentles is a pharmacist stationed at the Food and Drug Administration as a scientific analyst within the Division of Risk Management and is responsible for reviewing and developing complex risk mitigation and elimination strategies, called REMS, for medications with significant toxicity concerns. She is also a certified diabetes care and education specialist, a board certified pharmacotherapy specialist. She also currently serves as a consultant pharmacist, helping patients manage their uncontrolled diabetes through drug therapy management and education. Ma'am, you have the floor.
Thank you so much, ma'am, for that introduction. I must also add that I'm a proud graduate of Howard University College of Pharmacy. So now down to diabetes. Many of us at some point in our lives have heard of someone we know or someone maybe speaking in conversation that has diabetes. So let's begin with diabetes basics. What exactly is diabetes? Diabetes is a chronic health condition that impacts how your body turns food into energy. With diabetes, your body either doesn't make enough insulin or it can't use the insulin that it makes properly or as well as it should. There are a few types of diabetes. One being type 1 diabetes, which is typically diagnosed in children, teens, and young adults, and also needs insulin to take daily to survive. With type 2 diabetes is usually diagnosed in adults. And in this case, they have insulin, but the insulin may not be working as well in the body. It can sometimes be controlled with diet and exercise, or that individual may need to take oral medications or other injectable medications, including insulin. The last type is gestational diabetes, which is diagnosed during pregnancy, and it may also be controlled by diet and exercise, or you may have to have needed medications for this case. Next slide, please. So now we'll just go into a quick snapshot for diabetes. Every 17 seconds, someone in the US is diagnosed with diabetes, resulting in over 30 million individuals in the United States having diabetes, some of which do not even realize they actually have diabetes. African Americans are almost 2 times more likely to have diabetes than non-Hispanic whites. It's important that we address a couple of common myths that are related to diabetes. Me, growing up in the South, particularly in Georgia, I often heard people say they have a touch of diabetes. So one of the common myths is it possible to have a touch of diabetes? No, this is in fact false. A touch of diabetes actually means that you do have diabetes. It's either you have it or you do not. Another common myth is that people with diabetes need to follow a special diet, when in actuality, people with diabetes benefit from the same healthy diet that you and I would have. There may be some limitations, but we can all benefit from healthy foods. Another common myth is that you have to lose a lot of weight for your diabetes to improve. Actually, losing 10 to 15 pounds can improve your blood glucose, blood pressure, and your cholesterol. So what we have to remember is that with diabetes being so commonplace and everything, there are definite measures we need to take with regards to diabetes prevention and management. There are things that can be done if you actually have diabetes, which means you can talk with a local healthcare professional, being sure you eat a healthy diet, and also staying active. And then there are also things you can do to prevent diabetes or delay type 2 diabetes, which is, again, making sure you lose weight if needed, eating healthy, and also becoming more active. But what's most important is that you actually know your risk. And here's a test that's on this screen, which you can find and visit at this website to take. And that's actually www.diabetes.org/risk-test. And that way you can know better if you're actually at risk and things you can do to prevent developing diabetes. And at this time, I yield the floor back to you, ma'am.
Thank you, Lieutenant Commander Gentles, for your talk on diabetes. The next topic of discussion will be on dental health, given by Lieutenant Commander Falashayo Adenola. Lieutenant Commander Adenola is dually credentialed with Doctor of Dental Surgery and Masters of Public Health degrees. She currently serves as a dental officer in the Bureau of Primary Health Care, Health Resources and Services Administration, for short, that's called HRSA. She previously served as the public health analyst at HRSA HIV/AIDS Bureau, Division of Community HIV/AIDS Programs for over 4 years. Lieutenant Commander Adenola is also a diplomate of the American Board of Dental Public Health. Ma'am, you have the floor.
Thank you, ma'am. At this time, we'll focus on dental health. Next slide, please. So I'll start by sharing some basic information on oral hygiene. Every day, a thin film of bacteria called dental plaque builds up on your teeth. The bacteria in plaque produce acids. The acids in plaque damage the enamel covering your teeth. Enamel is the shiny white covering of your teeth, and it is the hardest substance in the body, even stronger than bone. Still, the acids in plaque can harm enamel and cause cavities. Brushing and flossing your teeth daily helps disrupt and remove the biofilm and plaque. This helps prevent gum disease and cavities. Dentists recommend brushing your teeth at least twice a day with fluoride toothpaste. You should also floss once a day. Next slide, please. So as mentioned, oral hygiene is necessary to prevent cavities and gum disease. Brush your teeth twice a day for 2 minutes each time using fluoride toothpaste. Be sure to brush all surfaces of your teeth. The fluoride helps strengthen tooth enamel and helps prevent tooth decay. Replace your toothbrush every 3 to 4 months or sooner if needed. A worn-out toothbrush will not clean your teeth as well. Next slide, please. Flossing is an essential part of taking care of your teeth and gums. Flossing removes plaque between the teeth and on the gums. Cleaning between teeth removes the plaque that can lead to cavities or gum disease from the areas where a toothbrush can't reach. Flossing is proven to help remove debris, such as food. This prevents food from being stuck between your teeth, which can contribute to plaque buildup. You should floss at least once per day, and it is best to floss before brushing. In addition to home care, dental exams should be completed by a dentist at least once a year. A typical dental exam will include a cleaning by a hygienist, x-rays on certain visits, and a checkup of your mouth by the dentist. The exam helps with early diagnosis of tooth decay and gum disease. Finding problems early makes it easier to treat. Also, professional cleanings help with identifying problems early, stain removal, and removal of hardened plaque that a toothbrush may not remove. Eating healthy, cutting down on sugary foods and drinks, opting for water instead of soda and sports drink, refraining from tobacco use are simple ways to prevent dental diseases. That's all on dental health. At this time, I will turn it back over to Lieutenant Adejuan. Ma'am.
Thank you, Lieutenant Commander Adenola, for sharing information on our health. Next topic that we will be discussing this afternoon is on opioid crisis, presented by Lieutenant Commander Nuri Tawab. Lieutenant Commander Tawab is a pharmacist who currently serves as a regulatory process manager for the Food and Drug Administration. He started his career as a clinical pharmacist on an Indian reservation in Arizona. He is also an official member of the Surgeon General education teams and provides public health education to the community. Sir, you have the floor.
Greetings, everyone. I'll be presenting information on opioids. As a public health service officer, we have been assisting our country with battling the opioid crisis. In my presentation today, I'll be going over what an opioid is, signs of overdose, and what can be done to reverse an overdose. First slide, ma'am. From 1999 to 2017, there's been more than 700,000 people who have died from drug overdose. On average, 130 Americans die every day from an opioid overdose. In fact, in 2015, we had 50,000 deaths that attribute to overdose. This is up 300% from 1999. As you look, sorry about that, just a moment. As you look at the different interactions we're having with our citizens and opioid crisis, as I stated, it's actually getting worse. And again, as PHS officers, we are doing what we can to assist in reducing these numbers. But main thing is the education. So what is an opioid? It's any drug that contains an opium or its derivatives. This can be a natural or synthetic drug that are chemically made. It can also be a prescription drug, or it can also be illegal drugs like heroin. But more prescription ones that we are commonly seeing: morphine, fentanyl, hydromorphone, hydrocodones, drugs like that. Opioids are actually used to manage pain. They suppress coughs and treat opioid use disorders. They cause feelings of euphoria, contentment, and detachment. Excuse me. Opioid overdose is an acute condition when an excessive amount of opioids are swallowed, inhaled, injected, absorbed through the skin, intentionally or unintentionally, leading to respiratory depression and possibly death. Next slide, ma'am. So who is at risk for overdose? The most likely person to overdose is an opioid-dependent person who has recently undergone detoxification or incarceration, IV drug use, high-dose prescription opioid use, as I mentioned before, concurrent use with other sedating medications, including over-the-counter medications like cough or cold medicines, a history of substance abuse, and also concurrent health conditions: asthma, chronic obstructive pulmonary disorders, sleep apnea, dementia, kidney disease, and elderly. Next slide, ma'am. So here are the signs that I want you to be aware of. These are really important. These are signs of someone who may be experiencing an opioid overdose. Loud snoring or gurgling noises. Body is very limp, unresponsive or unconscious. The skin feels pale, gray, or clammy. Lips and fingertips turn bluish. Pulse is slow or erratic. Breathing is very slow, shallow, or not at all. And here's an important one: you'll see pinpoint pupils. A big problem is the overdose symptoms can be displayed even when someone has not used opioids. In fact, an ill person may just have other illnesses like diabetes, stroke, or a heart attack, or dehydration. So this makes it very difficult to actually know if someone is having an opioid overdose. This is why the first thing one must do is important that they call 911 for emergency assistance. Also, a person may need other medical attention. So again, you want to call 911 first when you suspect someone of an opioid overdose. That needs to be the first thing. Next slide, ma'am. So here's information on actual medications that are used for opioid overdose. The main one that we have different formulations of is called naloxone. So the FDA first approved naloxone in 1971. The method was administered by syringe and typically used in healthcare settings. Later on, the FDA approved 2 naloxone administration products. As you see, the one in the middle called Evizio. This 2 milligram dose is actually kind of used like an EpiPen. You may see someone who have allergic reactions, like children or adults. And the device, it's really nice. It actually prompts you each step of the way when using the injection, sort of like an automatic emergency defibrillator. It tells you step 1, add the pads, add the right pads. So it's really helpful with sound and everything. The other one is to the right, you see is the Narcan, which is an inhalation spray. It's sort of like something like Flonase. So with Narcan, after you administer the first dose, if the person is not breathing or waking up, you can give them another dose in 2 to 3 minutes. So you actually you take the top off of the Narcan, put the tip into the person's one of the left or right nostril, and you press down on the plunger. They should wake up in about 2 to 3 minutes. If not, then you can do the other side in 2 to 3 minutes. The thing about Narcan, it won't harm someone who's not having an opioid overdose. If all it does is reverses an opioid overdose, but it wears off in about 30 to 90 minutes. But again, if you call 911 first and they're on the way and you give them a plunger on the left nostril or right nostril, and if not working in 2 to 3 minutes, you can do the other side. Ma'am, that concludes my presentation. Thank you.
Thank you, sir, for your presentation on opioid crisis as it's affecting our nation. Next slide, please. Thank you, sir. So the next topic of discussion is on fitness and nutrition, given by Commander Tisha Robinson. Commander Robinson serves as a pharmacy operations specialist for the Department of Defense. She's a board-certified geriatric pharmacist, a personal trainer, certified nutrition coach, USPHS Prescription for Change Tobacco Cessation Intervention Program, she's part of that. Also joined Humanitarian Operations course, and also has certification in diabetes care. Ma'am, you have the floor.
Thank you, ma'am. Again, I am Commander Robertson, and I will be discussing fitness and nutrition, starting off with an overview of the 5 food groups, and we'll end with the importance of exercise. Next slide, please. In order to take a deep dive on the 5 food groups, it's pertinent that I give you a quick background on the United States Department of Agriculture, or USDA. Abraham Lincoln established the United States Department of Agriculture. The USDA provides leadership on food, agriculture, how we grow our food, natural resources, rural development, nutrition, and related issues based on sound public policy, the best available science, and efficient management. To improve the nutrition of Americans, the USDA says that there are 5 food groups that we should eat from. The 5 food groups that you need include fruits, grains, vegetables, protein, and dairy. All help you to provide with the proper nutrients to help you grow and give energy. Let's talk first about fruits. Fruits like apples, oranges, and bananas are rich in potassium to help with healthy blood pressure. They also have added fiber to make it easier to go to the bathroom, and they give a lot of vitamin C to help heal cuts, healthy teeth, and gums. Vegetables. With vegetables, you want to eat a variety of colors like your broccoli, cabbage, tomato, carrots, as they are filled with several nutrients. Grains. It is important to make at least a half or 50% of your grains whole grains. Grains add sources of B vitamins, which help release energy, magnesium, which helps build bones, and selenium for a healthy immune system. Protein. With protein, if you're non-vegetarian, you want to choose lean protein as they are much lower in cholesterol and fat. Lean proteins include your chicken, turkey, and fish. For vegetarians, beans such as black beans, lentil peas are sources of protein. Protein is the building blocks for muscles, bones, skin, and blood. Last but not least is dairy. With dairy, you want to choose low-fat or fat-free. Dairy is full of calcium, which helps with healthy bones and teeth. Next slide, please. Exercise. The common rule of thumb is to get at least 60 minutes of exercise a day. Think about 60 minutes is only 1 hour of 24 hours you have in a day. Exercise can come in the form of something you love or enjoy to do, like walking the dog, dancing, running, or even more vigorous aerobic exercises. Regular physical activity or exercise helps to reduce your risk of heart attack, helps you manage your weight better, helps to lower cholesterol level, lower your risk of type 2 diabetes, have stronger bones, muscle, and joints, and lower risk of developing osteoporosis. So the rule of thumb is to ensure you have a right balance of energy in with healthy food choices and energy out with movements and exercise. This completes my presentation, and I'll turn it back over to you, Lieutenant Commander Adujuwan. Thank you.
Thank you, ma'am, for sharing nuggets on fitness and nutrition. Before we conclude this part of the session, we would give our audience an opportunity to post questions in the chat box that we can address to any of the speakers that just spoke during this session. So since there are currently no questions, this concludes part 2 of today's session. We thank everyone for giving great attention to the various topics that were shared during this session. We hope you've gleaned information that you found helpful. And we also indulge you not to keep this information to yourself, share the knowledge with friends and loved ones. And as we transition to part 3 for Jeopardy, I yield the floor to Lieutenant Commander Maria Clary, who will be moderating this session. Ma'am, you have the floor.
Lieutenant Commander Clary, I will turn the floor over to you for the categories and dollar amounts.
Good afternoon, participants. My name is Lieutenant Commander Clary, and my co-host today is Lieutenant Commander Culver. I hope you enjoyed the various healthcare topics from our fellow USPHS officers. Now, let's see what we have learned by playing a game of Jeopardy! This version of the game is very much like the televised version, with answers presented on a game board and contestants responding with questions. I encourage all to participate, so let's go over the rules. There are 6 categories. Under each column are 5 clues, phrase and answer form, which increase in value. In this game, everyone is a contestant. We will randomly pick a category and a dollar amount, and the participants will answer in the chat. I will read the category and the dollar amount, and a correct response earns the dollar value. So please keep a personal scorecard of your correct answers. This is a game to add a little fun to what we have learned today. Lieutenant Commander Culver, can you share with the audience the categories?
Here are today's categories. Our first category is opioids. Fitness and nutrition. Mental health. Oral health. Diabetes. COVID-19.
Okay, let's get started. So, can we start with opioids for 200, please? It is important to call 911 regardless of whether overdose is known for this specific reason. For all those that are participating, if you could put your response in the chat box. Answer, please. What is a person may be suffering from another medical issue? No correct answers in the chat box. Next question, mental health for 200, please. Tai Chi or yoga, taking a nap, exercise, and meditation are examples of this type of technique. Answer? What are stress reduction techniques? Thank you, Lauren Hill, for your response. Next question. Can I have diabetes for 400, please? This is how often patients in the United States are diagnosed with diabetes. What is every 17 seconds? Thank you, Ms. Anderson Booker. Next question. Can I have oral health for 100? This is how often it is recommended to brush your teeth in a day. What is twice a day? Everyone in pretty much in chat got it right. Next question. Diabetes for 200. When describing diabetes, some patients may refer to it as yes, what is a touch of sugar? Everyone pretty much in the chat has it right. Next question. Fitness and nutrition for 300. This is the recommended length of time to exercise daily. What is 60 minutes? Looks like half the chat had 30 and another half had 60. But what is 60 minutes is the answer. Next question. Can I have COVID-19 for 400? This occurs when fully vaccinated people become infected with COVID-19 and experience illness. Answer. What is breakthrough infection? Pretty much all the people in the chat answered it correctly. Next question. Can I have opioids for 500? When a person is experiencing an opioid overdose, their fingertips and lips may change to this color. Simply. What is blue? Next question. Can I have oral health for 300? This is the amount of time that you should brush your teeth. What is 2 minutes? Because everybody's been paying attention this afternoon. Yep, 2 minutes. Can I have diabetes 400? The chronic health condition impacts how your body turns food into energy. What is diabetes? Yep. All answers right in the chat box. Can I have COVID-19 400? This is the most transmissible and contagious COVID-19 variant to date. Okay. What is the COVID-19 Delta variant? Oh, the entire chat box says Delta variant. Great. Next question. Can I have, let's see, mental health for 400? This type of factor affects genes or brain chemistry and can contribute to mental health problems. So the answer is, what are biological factors? No one got it right in the chat box this time. Can I have oral health for 500? This is known as the hardest substance in the human body. What is tooth enamel? Yes, everyone has it right in the chat box. Next question. Let's go with fitness and nutrition for 100. This food group is full of calcium and helps with healthy bones and teeth. What is dairy? All answers correct in the chat box. Next question. Can I have fitness and nutrition for 500? This is the percentage of your plate that should consist of fruits and vegetables. What is 50%? So half the chat had it right. Next question. Now COVID-19 for 300. This is an effective and critical tool to bring the pandemic under control. What are COVID-19 vaccines? Majority of the chat had it correct. Next question. Let's go with opioids for 400. This is the length of time one should wait before giving a second dose of naloxone. Answer, please. Majority of the chat had it right. 2 to 3 minutes. Correct. Next question. Mental health for 500. This can negatively impact your mental health. Answer, please. Correct. What is stress? Everybody's been paying attention. Okay, COVID-19 for 200. Sharing COVID-19 information when you are unsure of trustworthiness can lead to the spread of answer, please. What is misinformation? Everyone has a right in chat box. Perfect. Next question. Can I have opioids for 100? This is the first thing to do if a person is suspected of having an opioid overdose. Yes, what is call 911? Next question. Mental health for 100. This type of health includes emotional, psychological, and social well-being. What is mental health? All answers correct. Next question. Can I have opioids for 300? The proper way to give naloxone is what is every 2 to 3 minutes if breathing is not restored. Next question. Can I have fitness and nutrition for 200? This food group includes chicken, fish, and peas. What is protein? All answers correct in the chat box. Next question. Can I have oral health for 200? This is how often it is recommended to floss in a day. What is at least once a day? At least once. The majority of the chat had it right. Next question. Can I have diabetes for 300? This is a type of diabetes that occurs during pregnancy. What is gestational diabetes? The majority of the answers in the chat were correct. Next question. Can I have COVID-19 for 500? This type of question is a good way to start a meaningful conversation and build rapport concerning COVID-19 vaccines. What is an open-ended question? All right, next question. Fitness and nutrition for 400. This is the recommended percentage of whole grain that should be consumed daily. What is 50%? Maybe one or two people will chat. Next question, mental health for 300. This affects how we think, feel, and act. What is mental health? Next question. Oral health for 400. This nicotine-containing plant increases the risk for gum disease, oral cancer, and teeth staining. What is tobacco? Next question. Diabetes for 500. There we go. The approximate amount of people in the United States with diabetes is it's over 30 million. Pretty much, we wanted to get it right. I want to thank everyone. I want you to place your scores if you tallied up all your points in the chat box. Oh, 4,400 and more. Okay, I want to thank you all who participated. Congratulations. This concludes our Jeopardy session. I want to thank you for your engagement. At this time, I'm going to turn the floor back over to Lieutenant Bejawan. She will open the floor for questions.
Thank you very much, Lieutenant Commander Clary and Lieutenant Commander Culver, for that very interactive session of Jeopardy. It was quite engaging. At this time, since we have still a little bit more time to go, if you have any pondering questions for any of the speakers that have spoken this afternoon, please kindly post it in the chat. We'd like to, address any questions, whether it was for the part 1 on the vaccine hesitancy or recruitment or any of the health care topics that was discussed. Kindly post those questions in the chat, and at this time, we'll be happy to take them. So I'll give us a few seconds to start posting the questions. And for those who are currently giving us feedback in the chat, we see, and thank you very much for the feedback that you are sharing with us. We also note that earlier there were a lot of questions that came in regarding copies of the slides or recording. We definitely will work with the sponsors of this event to see how the slides can be shared if they can. So we will let you know. Okay, yes, we do have a question that has come in. And I'll read it out loud. It says, what data exists to dispel the myth that the vaccination causes spontaneous abortions? I will address or direct this question to either Lieutenant Commander Echozo, or would you like to take that question, ma'am?
I'll yield the floor to Commander Marshall. Thank you.
This is Commander Marshall. Can you please repeat the question?
Yes, ma'am.
Sure.
It states, what data exists to dispel the myth that the vaccination causes spontaneous abortions?
I don't have that data directly, but I do encourage you to go to the CDC website, which lists some of the updated studies on the studies and information on the risks and the side effects of COVID-19 vaccines. Thank you.
Thank you, ma'am. And we still have a little bit more time, so please kindly keep the questions coming. Okay, seeing that there are currently no additional questions. Actually, I spoke too soon. I think another question did come in. This is about the vaccines again, so I may address this to Commander Marshall. The question states, beyond the myths about the vaccine, there is a lot of mistrust. How well do the incentives work to increase vaccination rates? So either Commander Marshall or Lieutenant Commander Echozo, you can take that question, please.
Lieutenant Commander Echozo, would you like to take a stab at that, or would you like for me to do that?
I could take a stab at that. I do recall us receiving that question at another presentation that we had, and at the time, incentives were newly implemented by different states. And I would say just a general answer that it really will depend from state to state on how well the incentive works. And I do have some information here from an article that when it was introduced in Ohio, that they saw a 6% increase in vaccination rates among people between the ages of 30 and 74. And this was coming off 3 weeks of a steady decline. So we do know that in some states, these incentives have been shown to work. However, I just have that particular excerpt for Ohio and cannot talk about the other states. I hope that's helpful.
Thank you, ma'am, for the response to that question. We do have another question that has come in, and it says, why do some people become ill after taking the second shot? And this is regarding the vaccines.
Yes, this is Commander Marshall. So the vaccine is when we experience various side effects following administration of COVID-19 vaccines. It's our body responding to the vaccine, and it's building up the immune response. And so when we're experiencing these symptoms, our body is in fact doing what it is supposed to do and preparing to mount an immune response in the event that we are exposed to COVID-19 vaccines. So side effects are anticipated and expected. Thank you.
Thank you very much, ma'am. We do have another question. This is regarding the pandemic on a general note. So the question states, is it true that it takes approximately 2 years for a pandemic to be eliminated globally?
This is Lieutenant Commander Chozo. So I will speak to that. I think in this case, it really depends on what is causing the pandemic, the virulence, as well as the public health measures that are taken. So right now we do have vaccines that are available, but we know the uptake of those vaccinations are not where we would like them to be. And these viruses are very smart and evolve, and hence we have the Delta variant, which is 2 times as infectious as our previous variant. So to give an approximation of when this would resolve would be hard to do. And I think from the pandemics that we faced in the past, I think it's hard to compare apples to oranges because it just really depends on the vector that we are treating. Thank you.
Thank you, ma'am. There's also another question. I'm not sure who to direct this to, but any of our presenters, if you can take this, please do. I will read it out loud. It says, why can't the federal government override the state governors when it comes to public health, especially our children? Politics are playing with our lives. This is one of the reasons communities of color doesn't trust.
Thank you, ma'am. This is Lieutenant Commander Chozo. So I would like to state for the good of the whole that the public health service, the officers within this service remain apolitical, and we cannot comment to that at this time. We are public health servants, but please feel free to use online resources maybe to provide an answer to that question. Thank you.
Thank you, ma'am, for addressing that. Okay. This is another question, and maybe we might need clarification or further information. This question is from Janine Jackson. It says, have you seen the social media memes in Baltimore City? If so, what is your opinion of such messaging? So, Janine Jackson, if you don't mind, if you can provide more context to the question. Okay, it's indicated that the memes are encouraging folks to get vaccinated. Okay, thank you for that comment. I guess, Lieutenant Commander Echoza, do you want to provide any further comment on that? I know we probably don't know how those memes look like, but if there's any general comment we can provide regarding just messaging in general for people to get vaccinated.
Unfortunately, I personally have not seen those memes to comment. However, as mentioned in the COVID presentation, there's been a plethora of social media content and content from other platforms, news, whatnot, that has been shared with the public. And what I would say in terms of appropriateness or trustworthiness is to see if the information is valid, if it's correct, by going to primary resources such as the FDA website, if you're looking for vaccine information, or the CDC website for guidance. So unfortunately, I cannot give a personal opinion of those messaging since I haven't seen them. But if you're not sure about the meme, I would say withhold from sharing unless you can verify the primary source of the information.
All right, thank you very much for that response. As we are winding down with time, at this time, I will pass, and we don't have any other questions in the chat box. I will pass the ball on to Lieutenant Commander Chuzo to close us out. Ma'am, you have the floor.
Thank you so much, ma'am. And I did want to answer one additional question from the chat. It says, this information was so valuable. Will you by any chance share this presentation or hold a virtual session with college students? On behalf of BCOG, you can send all inquiries to bcog.org@gmail.com, and it'll be received by our chair, Lieutenant Commander Bostic, as well as the BCOG Executive Committee for review and clearance by leadership. And then I believe we just received another question in the chat. Besides the Johnson & Johnson vaccine, do you have any knowledge about Moderna and Pfizer vaccines that cause blood clots? And I will yield the floor to Commander Marshall for this question.
Yes, this is Commander Marshall. That particular side effect, which is very rare, has primarily been seen in the Janssen vaccine. But I would also encourage you to go to the CDC website, which keeps an updated list of even rare side effects for all 3 COVID vaccines. Thank you.
See, we have some other chat questions coming through concerning health. We all talk about healthy foods. Are vitamins advisable? Commander Robertson, I would like to yield the floor to you for this question.
So for vitamins, if you're not getting the proper nutrients and minerals that you need from your daily food, vitamins and minerals does provide the extra supplement that your body will need if you're not getting it from your regular daily food choices that you're eating. Thank you, ma'am.
Thank you for that response. We have some other questions coming through. The pandemic and response to the pandemic has highlighted the differences in funding to HBCUs and majority institutions. After the pandemic ends, what can be done so that HBCUs continue to receive additional funding for infrastructure? And I do believe this may be out of our scope to answer. However, I do think it's a valid question and one that will solicit more discussion in the future. I hope that you continue to engage with your community as well as HBCU leadership and stakeholders to see if this can be sustained after the pandemic. All right, will such vaccines be made available in the US anytime soon? And Commander Marshall, I will direct this question to you as it's referring to AstraZeneca vaccine that's available in other countries, if you are at liberty to discuss that.
Sure, certainly. The AstraZeneca vaccine is not authorized for use in the United States. And you can find out additional information about that particular company's plans on their website. Thank you.
Thank you. At this time, we will close our Q&A session. We appreciate everyone who has put a question in the chat box, and we hope that we were able to answer it to the best of our ability. We'd like to thank everyone on this call for attending today's presentation. It was an honor to be here, and on behalf of BCOG, we thank you for all that you're doing in your communities as well as your HBCUs, and we hope that you continue to be public health ambassadors. Take care and have a great rest of your evening.